They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. Frontline Diary segment today, we're going to connect with volunteer at the Ottawa Hospital, Geneviève Haché. Good morning, Geneviève. Thanks for joining us.
Hi, thanks.
I understand you are a volunteer there at the hospital, what we would call a screener. Tell me about that role.
Yes, so I was a volunteer before working as a screener. So the screener is a paid position. So I was working as a volunteer with the Division of Orthopedic Surgery at the Ottawa Hospital before they hired me as a screener during the pandemic.
And that was specifically for the pandemic. In order to do what?
So we like to think of ourselves as the filters of the hospital. So whenever someone comes in, either a staff, a visitor, a vendor, or a patient, we ask them a couple of screening questions before granting them access inside of the hospital. So they are related to their health and how they're feeling, if they had any contacts with someone positive, and other questions like that. And we make sure they have their masks on, that they wash their hands, and they're all ready to go before entering the hospital.
Were you nervous at all taking this role?
It was pretty daunting at first. I joined the team in late March, so that's when everything started really blowing up. So at first, I heard about all this information coming in and all those new cases popping up everywhere. But this is a job in healthcare, which I'm really interested in. It's a really unique experience. And the team really helped me to feel comfortable in this environment with all these protection measures they had set up for us.
I understand you're going into your 4th year at the University of Ottawa for biochemistry. So is working there in the hospital something you'd like to do in the future, as in a career?
Yes, that is what I like to do.
And so are you feeling like what you're going through right now is setting you up for that future?
Oh, yes, definitely. Especially when it comes to patient interaction. It's given me a lot of really great experiences. It's an amazing team.
What kind of skills are you learning in that role with what you're doing right now that you know will be skills you'll have lifelong?
Yeah, so that's definitely interactions with people. And I've also been someone that had a lot of trouble saying no to people. But when it comes to this position, saying no to someone and granting them access inside the hospital or allowing them to go without a mask or different stuff like that could potentially put someone in danger. So it really forced me to really enforce those measures that we have implemented and trying to help keep everyone safe. But it's especially that communication with people and dealing with all different types of cases.
Yeah, you're, Geneviève, in a family of people who are frontline workers. Your mom's a nurse, I understand, and you have siblings who are on the front line as well. So I'd imagine you're in somewhat of a bubble then in order to stay safe for all of you. Is that tough for you at this age in your life, at this place in your life, to be on such a lockdown, if you will, and so devoted to work when you can't be out and having fun as much?
It's definitely different because I see all these different people, they're starting to go out and meet with their friends. And I would love to meet them more often, but I know that I can't because we have to keep everyone safe. But everyone in my family, we're all in this together. We're all working to help keep people safe. So for us, it's the least that we can do to help people.
What would be your message to the community in terms of getting people to, at any age, in our city, really take these measures seriously as we enter the fall season now, and we are seeing cases in schools, and we are seeing outbreaks again in long-term care facilities. You're there on the front lines. You're devoted to this as an employee at the Ottawa Hospital, as so many are. So from you, what do you want people to know that they need to know in order to help us all get through this together?
So the message that I like to spread as much as possible is be kind, be patient, and be compassionate. Because as you said, we're all in this together. We're all trying to get through this. And the best that we can do is help each other so that we can eventually get through this.
Well, they have some good people on the front lines there at the Ottawa Hospital. You among them, Geneviève. Thank you so much for joining us today.
Thank you very much. Have a great day.
You as well.